Hello. If you're experiencing low back, hip, knee, or ankle pain, and you couldn't quite figure out why it was occurring and how to get rid of it, well, have you ever thought that it might be coming from your feet? Stay tuned for this episode of PT with Dr. Steve, and I'll show you how your feet impact these areas of your body and what you can do to reduce pain in those areas simply by a simple treatment technique for your feet. Hey, it's Dr. Steve Massinio here again with another COVID episode of PT with Dr. Steve. And as you can see, I'm wearing a mask as I normally do with all of my patients. So is my son here, Nick, who is an aide here at one of our clinics. He's wearing a mask and keeping things clean for us in our clinic. Today, what I want to talk about, though, is those instances where you might be feeling pain in your ankles, your knees, your hips, and your low back, and you really don't know where it's coming from. And you probably tried maybe a couple different things to get yourself feeling better, but nothing really seems to work permanently. Well, one of the things, and actually before we continue, I'm just going to take my mask off so you can hear me a little bit better. Again, when we're in the clinic, we're always wearing our masks. But one of the things that we typically find with people who are having these type of symptoms that we can't figure out why the pain is being caused, sometimes we have to do is look really at the bottom of the chain, and that means looking at their feet. And so one of the things that we'll do, show as an example, is just kind of show you what I mean by getting down and taking a look at Nick's feet here. So here's Nick's feet, and you can see his feet are kind of turned out a little bit, and he has a little bit of pronation. In other words, his ankles cave in a little bit. And sometimes, because of his alignment and his feet being turned out, when he walks and so forth, that impact of gait mechanics, in other words, the feet not being in straight alignment and not being, having less support in the arches, can have an impact right up the chain to your ankles, your knees, your hips, and your low back. And so what we do is if we see somebody who's having a foot problem or a foot alignment type issue, where they're flat-footed or they're overpronating during their walking or they're turned out like Nick is a little bit, one of the techniques we'll do is we'll actually tape their feet. We'll give them some arch support. And that arch support allows us to assess whether or not they'll benefit from true arch support, i.e. orthotics, over the long haul to reduce those symptoms that they may be feeling at their ankles, knees, hips, or low back. And so what we're going to do is we're going to have Nick jump on the table here. Go ahead, Nick. Put your feet right over the edge of the table. Okay. And I'll just show you quickly the taping technique we utilize. We'll just do it on one foot here. Okay, and so let's make sure you guys can see us. Bring it down here. All right, so we'll take Nick's foot just like that. And like I said, we're going to give him some arch support. We're going to put a couple of pieces of tape just under here. This is Leuco tape. It's a thicker tape, more supportive. And we always educate our patients on what they should be feeling when they're wearing this tape. It is somewhat restrictive. It can be a little uncomfortable at first, but we just make sure that they understand that. And if they at any point in time are feeling a little more uncomfortable as a result of using tape, we have them stop. Okay. So I'm just going to demonstrate using one piece of tape for today, just to get my point across. So I start here on the outside, right there. Okay. And I take the tape. Give Nick a little turn, give his foot a little turn, come up and over like that. And we usually do two pieces of tape. I just want to demonstrate, but this gives him some arch support. And now when he's walking, if it's going to benefit him, he'll have less pain in those structures that maybe he was feeling pain in, say, again, knees, ankles, hips, low back, as a result of correcting his gait mechanics a little bit by providing the arch support. If that happens, and we test over several sessions of physical therapy, and he's noticing a difference by primarily using the tape versus anything else we do, then we'll generally recommend orthotics. But we go through a testing process first before we make somebody invest in a pair of orthotics that they'll be wearing in their shoes for the rest of their life. We want to make sure that this is the right strategy. But anyway, this is something that we find that's really helpful for our patients who have foot mechanic issues that are causing pain up the chain. If you have low back pain or any other pain in your knees or hips or ankles that you can't figure out and you want us to do an assessment on you, you can give us a call at 508-845-3500. We'll get you in for a free physical therapy screening at one of our 3 clinic locations. or you can go to our website, allaccesspt.com, and register for a physical therapy screening there. We'll sit down with you, we'll take a look at you, see if foot mechanics might be a problem, or if you're having just some other issue. Either way, we'll give you a plan of care, recommendations for helping yourself, and ultimately, if you feel like we feel like you need physical therapy and you agree, we'll get you into some care here at one of our clinics. Thanks so much for watching, and we'll see you soon.